I'm Stephen Cohen, I'm a GP in Busselton. Most of you will know where Busselton is, but we're a town of 30,000+ people. I work at Duchess Medical Practice, which is a large medical practice. We usually have 8 or 10 GPs on at any one time, and I was going to talk about the mental health nurse working in our practice, which is a Commonwealth Government initiative. We have had a mental health nurse working with us for the last 9 years. We were one of the early adopters of the scheme.
Okay, I'm Reg Rankin. I'm a registered mental health nurse, which that registration doesn't really exist anymore. I'm a registered nurse. I'm also, in order to do this particular role, a credentialed mental health nurse, which is a requirement under the initiative. Through the College of Mental Health Nurses, needs to be evidence to show ongoing professional development, etc. And that's a process that has to be gone through every 3 years.
So, what sort of patients do we refer to, Reg? We did take some statistics out a few years ago, and as you might expect, the overwhelming majority are people with affective disorders, particularly depression. The number of people with schizophrenia and borderline personality disorder is greater than their proportion of the population, but it's still a minority of those cases. How do we integrate with other services? We have a pretty reasonable relationship with our local government mental health service. They occasionally refer patients to us that they think would benefit from attending a practice with a mental health nurse. I can hear some of you thinking that we don't want that, but in fact that's a very small number of patients, and our relationship has been such that typically they will speak to us beforehand. So if it's a patient that we don't think we can manage in general practice, we will say so. There's only a very small number of those patients, but if, for example, a patient is likely to commit an act of violence and needs 2 mental health nurses to visit them at home to administer medication, for example, then we're not able to offer that service. The number of things that we ask Reg to do, there's a variety. At the simplest, it may be that someone who I'm concerned about, that they need some more support, I may ask Reg to contact them to offer that support in between visits to me, particularly at the beginning when we're starting medication. There are many patients who will be treated for a short period of time when they're at acute need. There is a small number of patients who we're not realistically expecting that they're going to make a complete recovery, for example, chronic schizophrenics, and unlike the government mental health service where there is a bit of pressure to discharge people from the service, we're here in the long term. I've been here 25 years, so there are patients that we've known for that long or have attended the practice even longer.
I've found the connection between the public sector role, which I also am still involved with up at the inpatient unit at Bunbury, and the practice here is beneficial to the patients from the point of view that there's a familiar face if any of the patients do actually get to the point of requiring admission.
Other roles that Reg has taken on would include offering some counselling at home or at the surgery. And I should mention that he sees people in both locations. There are people who would prefer to see him at home, and when he does do home visits, that gives both him and whoever the GP is that's responsible a really useful insight into how they are managing and coping at home. as we all know, some people are at their worst when they come and see us with their complaint, and there are other people who have put on their best front, so we get a more complete picture of how they're doing. Some years ago we did do a formal assessment of how the other staff here viewed the service, and it was uniformly positive. Other GPs have had the same experience that I have, that Reg is a useful second opinion about patients, very useful for doing that follow-up and reaching out to patients, but the receptionists and the nursing staff have called on him when someone comes in acutely distressed. Here's another resource when there isn't an instant appointment available with a doctor. Reg can be very useful at calming a patient. One of them is finding a suitable staff member. There aren't an oversupply of mental health nurses, and just to make matters a little bit more complicated, the program requires that we employ someone who is accredited by the Australian Mental Health Nurses College, and not all mental health nurses in the hospital system have that accreditation, so finding suitable staff can be a challenge. Within a practice such as ours, which employs a number of doctors, sometimes physical space for Reg to consult is an issue. Financially, the scheme, when it was first set up, gave us a small grant to pay for some equipment, so we were able to buy a mobile phone and a laptop for Reg's use. But overall, the program, from our point of view, has been tremendously successful in improving the care we can give our patients and taking pressures off the doctors and the other staff. And in terms of a model for delivering community mental health services, I think it has enormous advantages compared to having a mental health nurse that we would access through some other provider. Having worked in the UK as well as in Australia, I would see locating nurses and allied health professionals within general practice as a fantastic initiative, and I would urge any of you that are watching this video to consider whether you want to employ your own mental health nurse.
I must say that when I came to the practice, I was quite surprised by the number of patients that with the mental health diagnosis that the GPs were seeing. I'd seen just such a small snippet of them when I was liaising with the GPs in my role in the public sector, and I had no idea the extent of just what they were dealing with.